Your doctor schedules a routine test. You don't question it. Most people don't. It feels responsible. It feels like the right thing to do. But there's something very important that many people over 70 are never told. Some routine screenings may not always work in your favor, and in certain situations, they may lead to more complications than clarity. Not because medicine is wrong, but because the way your body responds after 70 is very different from how it responded at 50, and this changes everything. Let's start with a simple idea. Screening is designed to find problems early, and for many years that approach works very well. When you're younger, finding something early often leads to better outcomes. You have time, your body recovers more easily, and treatment is often more straightforward. But after 70, the equation changes, not dramatically, but significantly enough that it matters. There are three important shifts that happen. First, many conditions develop very slowly, so slowly that they may never affect your daily life. Second, your body becomes more sensitive. Procedures that were once routine may now carry higher strain. And third, there is something called a chain reaction. One finding leads to another test, which leads to another step, and before you realize it, you're in a sequence of interventions you never expected. Now let's walk through a few common screenings, not to create fear, but to give you awareness, so you can ask better questions and make decisions that fit your life. Let's begin with something very common, a routine colon check after the mid-70s. For many years, this has been considered standard, and in the right situation, it can be helpful. But after a certain age, the balance begins to shift. The preparation alone can be demanding. It can affect hydration, electrolytes, energy levels. And for some people, that preparation is harder on the body than expected. Now think about this. If you've had normal results in the past and you have no symptoms, the likelihood of finding something that would change your life meaningfully becomes smaller, but the strain of the process remains. So this becomes a conversation, not an automatic decision. Now let's talk about another area, cancer screening. This is one of the most sensitive topics, and it needs to be approached carefully because the goal is always to protect health. But here's something important. Not every finding leads to a problem, and not every problem needs aggressive action. Some changes in the body develop very slowly and may never interfere with your daily life. But once something is labeled, it often leads to further steps, testing, procedures, treatments, each with its own impact. Now imagine this. You feel completely fine. You go in for a routine screening. Something small is found, and suddenly, you're making decisions about procedures you never expected. This is why context matters, age matters, your overall condition matters. Now let's look at something that surprises many people. Heart testing without symptoms. It sounds logical. Checking your heart feels responsible. But here's the challenge. These tests can sometimes show results that are unclear, and unclear results often lead to more testing. Now imagine this. You feel fine. You stay active. You have no discomfort. But a test suggests something might be worth exploring. Now you move to a more involved procedure, and each step carries its own level of strain, even if everything turns out fine. You've gone through a process that may not have been necessary. So again, this becomes a question, not an automatic step. Now let's talk about bone health, another important area. Falls are a real concern, and protecting strength matters. But here's something often overlooked. The most effective support for bone health is not always a test. It's daily habits, balance, movement, environment, reducing fall risk. These small actions often make a bigger difference than people expect, without adding complexity. Now here's another screening that sounds very logical, checking blood flow to the brain. It seems like a good idea, but in people without symptoms, findings can sometimes lead to decisions that carry their own risks, And this is where balance becomes important because doing something is not always better than observing carefully. Now let's pause for a moment because this is the most important part. This is not about avoiding care. It's about understanding timing, understanding context, and understanding your own situation. So what can you do? This is where things become practical because the goal is not to refuse care. The goal is to make informed decisions. There are 4 simple questions you can ask, and they change everything. First, what exactly are we looking for, and how likely is it to affect my daily life? Second, if something is found, what would the next step be, and what would that involve? Third, what happens if we don't do this test right now? Is waiting a reasonable option? And fourth, is there a simpler way to get useful information? These questions don't create conflict, they create clarity, and any thoughtful professional will respect them. Now imagine this. You walk into your next appointment, not with fear, but with understanding. You listen, you ask, you think, and you decide based on what makes sense for you. That changes everything. Because after 70, health is not just about doing more, it's about doing what matters, avoiding what doesn't, and protecting your quality of life. Now here's the truth. Your body is not the same as it was 20 years ago, and that's not a problem. It just means your approach needs to evolve. More thoughtful, more intentional, more balanced. So next time a routine test is suggested, pause for a moment, ask a question, understand the reason, and make a decision that fits your life. Because your health is not just about adding years. It's about how those years feel, how you move, how you live, how you enjoy your time. And often, the best decisions are not the automatic ones. They are the informed ones. If this gave you a new perspective, take a moment to think about your next step, because small decisions, made with clarity, can shape your future in a powerful way.